Greetings and welcome to In Depth. I'm Dike Rostant. International Women's Day belongs to everyone, everywhere. Now, inclusion means all International Women's Day action is valid. Now, with that quote from the internationalwomensday.com website, we are joined by clinical psychologist and assistant professor of psychology at UTT, Dr. Margaret Nakit Chatur, to discuss embracing equity in mental health. Greetings, Dr. Nakit Chatur. I want to start off by asking about the significance of the motto, embrace equity, please.
Greetings to all of our viewers and universal greetings to all of our women, especially those who continue to cope and to take care of their families despite their circumstances. So this year's International Women's Day, the campaign theme is Embrace Equity. And it moves it away from the word equality, moves the conversation forward, because equality can be a bit exclusive and not inclusive, especially when you talk about equality and you give the same opportunities, realizing that not everyone can start in the same way or has an advantage in life as others. So this year, Embrace Equity wants to separate the two, wants us to see the differences between equality and equity. A lot of people think they are interchangeable or they mean the same. But again, as we all know, one size does not fit all. And there are persons who come from adverse circumstances, who are disabled, who are not able to achieve the same goals because of the high risk factors in their life as opposed to the protective factors. When we talk about inequity, inequity affects many people, but most commonly persons in marginalized communities, those especially women, especially persons of color, those who have disabilities, as I said, those who are disadvantaged, and persons who are LGBTQ. But when we talk about equity, which is our focus this year, we want to acknowledge that persons begin life, not everyone in the same place, and equity allows us to give individuals whatever is necessary to achieve the same goals as others in our society.
No, and thank you for reading and spelling for me and also making that distinction between equality and equity. But Dr. Nakit Chatur, in terms of the way that you've advocated, it seems as though you have a special place in your heart for women and children, or the rights of women and children. And articles, publications, things that you do, they espouse that theme. But in terms of bringing in that aspect of mental health care on International Women's Day, is there a reason for you doing it like that?
Yes, of course. Thank you, DK, for that question. So that mental health equity is health equity, and it is critical for all. However, in many societies, across many organizations, as you know, the emphasis is on health equity, physical health equity. And a lot of persons don't realize that they are interconnected. If you do not have physical health, it affects your mental stability. If you have mental illness, it affects your physical health. And I focused on mental health equity because in our society, women have higher rates of mental disorders such as depression, anxiety, eating disorders, trauma-related conditions. Women also are more likely to be victims of trauma or abuse related to incidents of domestic violence, of human trafficking, of sexual assault. And we also know, thirdly, that women who come from minority groups, who are illiterate, who are disadvantaged, dispossessed, those who have disabilities, they would be the ones less likely to access care, public health care, even if it is available. So I stress mental health care because I do not want us to forget that this is an underlying factor, a trigger in our society that causes a lot of instability. And we cannot feel that when there is public health care, that we are taking care of mental health care at the same time, unless we spell it out and unless we pay particular attention to mental health care, especially for our women.
And in terms of taking that, spelling it out, uh, it seems as though sometimes individuals are not able to make that time, to make that distinction, to take that step back, to take that breath and count to 10 or whatever number you need to count to, because that kind of makes you remove that superhero costume. And you started off our conversation by talking about those women who take care of their families regardless of the situation. What are some of those things that you think people may be able to do while I can't move from the situation too much to get as much care as I think I may? I may not even know where to go, but just how do I start? How does a woman start to be able to address some of those concerns, Dr. Naki-Chatur?
All right. So as you know, Dike, in our society, a lot of things are triggered by the systems that are already in place. And when we talk about equity and women's access to equity, I also want, let's look at the other side of the table, which are what are the inequities in our society in Trinidad and Tobago at present that prevent women from coping, from taking care of their families as they would want to. And I think the most glaring factor is the lack of information that we have in the society regarding where to go, how to access COVID, how to access proper health care. And the COVID pandemic highlighted to us a lot of this mental instability, because when that happened, we had a lot of people calling in, frightened where to go, what to do, where do I go, how do I access services, triggering a lot of mental instability, a factor in our society that again was not properly addressed. Secondly, we have an inequity where the referral systems are concerned. Many persons, if they have to access healthcare, they have to get a letter from a doctor, they have to get a diagnosis. In our education system, a lot of our children who have mental issues, they have to get some sort of assessment before they can access services, before they can access psychoeducational availabilities, etc. A third is women who lack linguistic capacity. And I remember going into public offices sometimes and women cannot even explain what they want, what they need. This is a glaring inequity. And now we have a Spanish population, even if we have to say that women, our immigrants who may not even know what to say, how to access healthcare. And lastly, we're looking at logistics, where people come from, the psychological barriers, the sort of economic barriers, transportation from their homes. I remember a minister of health once saying, we have a lot of clinics, mental health clinics. If something is happening with a member in your family, go. I found that to be such an insensitive and myopic statement. How do women get from their homes to these clinics and hospitals? What are some of the barriers that are in place where they would not even want to access healthcare? So before we even look at equity and what women can do and how they can cope, we must examine what are the present inequities in our system that still disallow women from accessing healthcare, not only for themselves, but also for their families.
But that is a point that I want us to come back to when we return from the break. We are speaking with Dr. Margaret Naki-Chatur. Stay with us. We return with more. Welcome back. We are speaking with Dr. Margaret Naki-Chatur, looking at embracing equity, the mental aspect of it as well. And I really appreciate that fact you're talking about, being able to articulate. People talk about if you can't measure, you can't manage it, Dr. Naki-Chatur. Sometimes a person may not even be able to say, okay, well, this is what I am feeling to themselves, much less try to articulate that feeling, be it a language barrier or just not having that words to say if you're using the same language as the person that you're trying to relate to. And I go back to the question, what are some of the things that we can start off with? A woman who is in a situation like this can start with even before trying to seek access to mental health outside of their doors.
Right. And thank you, DK. And we're looking here, as you just said, about cultural factors. The stigma in families of seeking help, the stigma, and this stigma has passed on from generation to generation, as I call it, the culture of silence. There are things happening in families where, families tell the relatives, don't tell anyone, keep it in the family. Don't, so that people do not want to access help because they do not want to involve others. And if you go out there into the systems, you must trust the system to help, and the system must access your family problems. So the first glaring issue there again is a cultural issue, the stigma of needing help but not knowing where to go, wanting help and not knowing how to articulate it, and also the generational culture of silence that says, you know what, leave it alone, don't tell anybody. Then I think we have systemic factors in our society. We talk a lot about now higher rates of NCDs, cardiovascular, respiratory illnesses, blood pressure, etc., not realizing that these are heavily linked to trauma and to stress in our society. And many providers, I think, do not ask relevant questions. And I say this because I have colleagues who work in hospitals, where they list all those persons who may have attempted suicide. They list it as incidents. Somebody comes in with burns, somebody comes in with certain things happening, and they don't ask the questions. They don't ask the questions that link it to stress, that link it to trauma, that link it to some kind of mental instability, so that that person who comes in can get the needed help. So again, systemically, we're not asking, I think, and we have to, when we talk about inequities, we can carry it wider through our society, but let's look at our healthcare systems, our healthcare providers, our social workers, our mental care assistants, our psychologists, all of these people who deal with others, especially women entering our systems. I think we need to redesign our policy so that we ask the necessary questions, we break down those barriers, we provide opportunities so that mental care providers can really assist. And I can tell you, we have an ethical responsibility to have a society where healthcare is the top of our list. And that responsibility rests on those who are providing these services, not to trivialize it, but to consider the ecological context from where these persons are coming from, their lived experiences, and not to disregard it as trivial. So I take very strongly that second factor of systemic irregularities and not asking the proper questions. And we have also women coming from different geographic locations in the society who really cannot have, who don't have the financial resources to access services. Then we have, lastly, I think the absence of policy driven solutions where leaders in mental health agencies and individuals must consider that health equity, mental health equity, is an important part of our whole drive towards health wellness in this society.
Now, you've spoken about building the infrastructure, having it, looking at the culture of it, having individuals be a little more sensitive in their messaging, the narratives that they're looking to purport, looking a little more at the macro. How can we bring that to on the individual level or the family level? Yes, you did say that some people might say, no, keep it in the family. But even if someone is trying to keep this in the family, what are some of those ways, incremental steps that we can use if there is a great deal around that individual who are not aggressors and they are trying to help? What do you say to them? What steps do you give that person or those people?
And this is where education comes in, education through the schools, education through our public health systems, education through our social media, more messages. I am very pleased to see that recently I've seen where a lot of our social services, family social services, and even places like the Children's Authority. And so they're putting messages out there, messages of if this is happening, then do this. But again, social media can be limiting. Who does it reach? And I know that during the COVID, a big problem that I had was that the narrative reached persons who could access these services, who were on social media, who had cell phones. What about the persons who don't have these abilities and don't have these resources? How do we reach persons on the ground? And I think for too long in our society, we tend to neglect or cast a blind eye to those persons who need mental health services, who live in far off areas, geographical locations that are not easily accessible. How many mental health care workers do we really have per thousand in this society? I don't think many. And what is the data? We don't have, maybe it's available, but I believe, Dike, that we do not have visible data that tells us what are the necessary things that we need still to put in place for underprivileged societies, communities where we have many minority groups and where resources are not readily available. So what do we do in families? We must reach those families. Social workers must reach those families to provide information necessary. So we need personnel on the ground. And I wouldn't say that these families must come out, as some of our people think, okay, it's in the society. If you're not accessing it, that's your business. I think that's an insensitive comment. There are many persons who are not able to access the mental health and physical health services that are available in this country.
All right, and last minute, I'll ask you to just sum up your thoughts on embracing or improving equity and on a mental health level as we are here on International Women's Day. Thank you.
Thank you. So we need equity-driven based solutions in the society. We need insurance coverage. I think, what are the insurance companies who provide coverage for persons with mental illness, especially women? I think there is just one provider. We pay a lot of attention to physical health. Mental health is important. We need proper access, secondly, to psychosocial services. We need, thirdly, to provide training for social workers and mental care physicians, training where they can understand the cultural and dynamic context of these people, where they live, and not let it be top down and not disregard their lived experiences. And again, lastly, collective activism. Everybody involved, all stakeholders involved. Collective activism will drive change for mental health, especially for women with mental illness in our society.
Thank you so much, Dr. Margaret Nakich-Chatur, Assistant Professor of Psychology at UTT, as well as clinical psychologist, looking at embracing equity in mental health. And on behalf of the entire TTT News team, I'm Dike Rostant. This has been In Depth with me. Thank you so much for joining us.